November is National Diabetes Awareness Month, and we'll be talking with Dr. Beth K about this month about that. But today she joins us to break down the difference between type 1 and type 2 diabetes. Good to see you this morning, Dr. Beth K.
It's good to see you too, Mike. Yes, a lot of people confuse type 1 and type 2 diabetes. They have some similarities, but they're also very different. One of the big similarities is that in both type 1 and type 2, the blood sugar stays too high after you've eaten a meal, and it doesn't come back down. When you and I eat a meal, our blood sugar goes up, but then our insulin gets in there and takes it back down to normal. This doesn't happen in diabetes as well. Type 1 diabetes, which represents only 5% of the total cases of diabetes, it's relatively small, is more of an autoimmune disease. And this is where the body, for some reason, is not making very much insulin at all. And so when the person eats, the blood sugar goes up, doesn't go back down, because insulin tells our body cells, take in this sugar so you can use it for energy, for your muscles, for your brain, for all the cells of your body. And so the blood sugar stays high. This is more common in younger people, in babies, children, young adults. It can happen in older adults, but it's more common in young adults. Now, type 2 diabetes, people are making insulin. Sometimes they're making a lot of insulin. The problem here is that the body cells don't respond to the insulin. So the insulin's knocking on the door, and the body cells, they may open it a little bit, but not very much. So the blood sugar stays high. About 95% of the people with diabetes have this type of diabetes. And it happens in middle-aged, older people. We're seeing it in younger people. And so you can see the two diseases, the blood sugar's high, but for very different reasons.
Obviously,
and with type 2 diabetes, a lot of lifestyle factors. So diet, exercise, but genetics also play a big role in type 2 diabetes.
Yeah, I've seen that in my own family, and I know some people who, they don't regularly get checkups, so they don't get tested. So what about the symptoms, and are they similar between the two?
Yes, they are somewhat similar between the two types of diabetes. So first of all, people feel very hungry and they don't know why. And the reason is because if that blood sugar is not getting into the cells, then you're starving, because you need that blood sugar to do the work that you need to do. And so you might feel very hungry. Your body's telling you, you need to eat more because I'm not getting energy. You also may feel very tired because, again, the blood sugar is not getting in there to give you energy. Excessive urination. This sounds interesting, right? Why would you urinate more? Well, the blood sugar's got to get out of the system somehow. And so a lot of times it gets to the urine, and so you're urinating a whole lot. And then also for type 1 diabetes, you see unintentional weight loss. With type 2, you can see either unintentional weight loss or weight gain. So, and you also will feel excessive thirst because of that excessive urination. So any of those symptoms, talk to your doctor because it might be a sign of diabetes.
And I think we only have just a few seconds left, Dr. Beth K, but obviously if you don't get a check, that can lead to some very severe problems.
Long-term out-of-control blood sugars can lead to heart disease. It can lead to high blood pressure, eye damage, blindness, nerve damage. You hear people getting amputations and things and all kinds of horrible things that you can prevent if you get checked and get treated. And that's what we're going to talk about in the next segment is, well, how do we take care of diabetes so we don't have all those really horrible outcomes? Because that's the great news about diabetes. You can treat it.
Very important that you tune in as we talk about this very, very important health condition. Dr. Beth K, we appreciate it. Thank you.
Thank you, Mike.
All right, we'll be right back.